Hi everybody, welcome to the Rare Wellness Podcast. In this podcast, we explore cutting-edge ideas in regenerative, longevity, and performance medicine, all delivered in bite-sized segments. I'm joined today by Becca Pomona, one of our performance medicine nurses here at the Center for Regenerative and Performance Medicine.
Hi everybody, this podcast is brought to you by the Center for Regenerative and Performance Medicine, located here in the beautiful Pacific Northwest. You can visit us online at www.c4rpm.com.
Before we begin, a quick disclaimer. This podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified healthcare provider for any medical concerns or treatment.
Okay, so let's get into it.
Becca, I'm excited about this one because we're talking about Sermorelin, and it's a peptide I think a lot of people have heard the name of but don't really understand how it's different from taking growth hormone directly.
Yeah, we're having patients ask about this all the time, and there's so much information online. Some of it's great, some of it's not so great. So breaking down the actual science is super valuable.
So let's start with the basics. Sermorelin is a synthetic peptide, the first 29 amino acids of growth hormone releasing hormone, or GHRH. Your hypothalamus makes GHRH in your pituitary gland to produce growth hormone. Researchers found that those first 29 amino acids are all you need for full biological activity.
And the key distinction is that it's not growth hormone itself. When someone takes recombinant HGH, they're putting preformed growth hormone directly into their body, which bypasses your pituitary entirely. This creates unnatural spikes and can suppress your body's own production over time. Sermorelin works upstream, so your pituitary is staying in control.
Exactly. Somatostatin, your body's growth hormone brake pedal, stays active. So even though Sermorelin growth hormone is released in a pulsatile regulated way, it's essentially very difficult to overdose because the feedback loop stays intact. That's a fundamental difference, safety profile, than direct human growth hormone injections.
So there's a bit of history that's important here. Sermorelin was FDA approved in 1997 under the brand name Giraffe for growth hormone deficiency in children. It was discontinued in 2008, but not for safety reasons. It was a manufacturing issue. The FDA formally confirmed that in 2013.
So today it's available through compounding pharmacies with a valid prescription. Now, let's talk about why this matters for adults. Growth hormone isn't just about growing taller as a kid. In adults, growth hormone regulates body composition, it drives protein synthesis, promotes fat breakdown, supports bone density, immune function, cognitive function, and plays a major role in sleep quality.
And here's the kicker. Growth hormone production starts declining around the age of 30, dropping roughly 15% per decade. By 60, you might produce only a quarter of what you made at 25. That's called somatopause, and it tracks with what people chalk up to normal aging, which is maybe more belly fat, less muscle, poor sleep, brain fog, and slower recoveries.
And I see in practice is patients exercising and eating well, but still gaining visceral fat, losing muscle tone, and recovering slowly. And it's not a lack of effort. Their hormonal environment has shifted underneath them.
So what does the research actually show? One key study looked at men and women aged 55 to 71 who received nightly Sermorelin for 16 weeks. IGF-1 went up significantly, and in men, lean body mass increased by about 1.26 kilograms, close to 3 pounds. They saw improved insulin sensitivity, well-being, and libido.
And another study in elderly subjects showed improved waist-to-hip ratios, suggesting redistribution away from visceral fat. A meta-analysis on growth hormone therapy found treatment increased lean mass by about 2 kilograms while reducing fat mass by a similar amount. The scale might not move dramatically, but what you're made of is changing. And that's the meaningful change of metabolic health.
That's exactly the kind of recomposition we track with body composition scans at the clinic. You might weigh the same, but you've swapped fat for muscle, and that is a metabolic win.
Now let's talk about what I think is Sermorelin's most compelling benefit, and the one patients notice first: sleep. Becca, walk us through that connection.
Yeah, this is huge. About 70% of daily growth hormone secretion happens during deep sleep, stages 3 and 4 of non-REM, called slow wave sleep. That's when your body does its most critical repair. Tissue recovery, immune regulation, memory consolidation, and the relationship is bidirectional. Growth hormone promotes deep sleep, and deep sleep drives growth hormone release.
So it's a positive feedback loop when things are working well. But as we age, we get hit from both sides. Deep sleep duration can drop off 50 to 70% by age 50, while growth hormone is declining simultaneously. you end up in a negative spiral. Less deep sleep means less growth hormone, which means even less deep sleep.
Sermorelin interrupts that negative cycle. Administered before bedtime, it amplifies the natural nocturnal growth hormone pulse. Research shows significant increases in both growth hormone levels and slow wave sleep when GHRH analogs are given during the first half of the night. Patients consistently tell us deeper sleep and fewer nighttime awakenings are the first things that they notice, usually within 1 to 3 weeks. Sermorelin interrupts that negative cycle. Administered before bedtime, it amplifies the natural nocturnal growth hormone pulse. Research shows significant increases in both growth hormone levels and slow wave sleep when GHRH analogs are given during the first half of the night. Patients consistently tell us deeper sleep and fewer nighttime awakenings are the first things that they noticed, usually within 1 to 3 weeks.
And I want to distinguish this from traditional sleep medications. Prescription sleep aids like benzodiazepines actually suppress deep sleep. They sedate you, but the architecture of your sleep is worse. Sermorelin enhances the restorative stages by working with your body's hormonal system. No dependence, no rebound insomnia.
Yeah, and that is such a critical distinction, and the timing of administration is also important. Taking it 30 to 60 minutes before bed aligns it with your body's natural sleep onset. Interestingly, research showed that when GHRH was given in the early morning hours, it actually had no effect on sleep because your cortisol-driven wakefulness signals override it. That bedtime window is what really makes it work.
And I'd add that for patients who are already addressing sleep hygiene, like a dark room, consistent schedule, no screens, but still not getting restorative sleep, Sermorelin can be the missing hormonal piece. It's not a replacement for good sleep habits, but for people whose growth hormone access has declined, it fills a physiologic gap that no amount of sleep hygiene can fix on its own.
So now let's address a common misconception. People sometimes confuse Sermorelin with steroids or think it's the same as human growth hormone. It's not a steroid. It doesn't introduce exogenous hormones. It doesn't cause androgenic side effects. It's a signaling peptide that tells your pituitary to do its job more effectively. And because the feedback loop is preserved, you don't get axis suppression.
The most common side effects in the literature are mild injection site redness, occasional flushing, rarely mild nausea. That said, it's not appropriate for everyone. Active malignancy is a contraindication because growth hormone and IGF-1 promote cellular proliferation. Pituitary tumors, uncontrolled diabetes, and pregnancy are also contraindications.
And sourcing matters enormously. Studies on unregulated peptide products found impurity levels exceeding 95% in some cases. That's essentially not even the peptide sourcing through a licensed compounding pharmacy with a prescription is non-negotiable.
And I want to be really direct about this. Do not purchase research peptides off the internet and inject them. Those products are labeled for research use only for a reason. They're not manufactured under the same quality standards as a compounding pharmacy, and they're not tested for sterility and purity the way prescription products are, and you have no idea what's actually in the vial. We've seen patients come in after using those products with no results or worse, with reactions they shouldn't have had because they weren't getting what they paid for. And the timeline is important for patients to understand. This isn't an overnight fix. Most people notice sleep improvement within 1 to 3 weeks. Energy, recovery, and skin quality changes tend to come around 4 to 8 weeks. Meaningful body composition shifts, measurements on scans typically emerge 3 to 6 months later. You're retraining your pituitary, and that's been underperforming for years. It takes consistency and patience.
Which is also why we emphasize that Sermorelin works best as part of a comprehensive approach. Pair it with nutrition optimization, resistance training, which itself stimulates growth hormone, and address other hormonal axes like thyroid, testosterone, and estrogen where appropriate. The peptide amplifies the work that you're already putting in.
Now, before we go to the takeaways, I want to mention two populations we haven't talked about yet, and I think are really relevant. The first is younger patients, people in their late 20s and 30s who are training hard but hitting a plateau. They're doing everything right in the gym, nutrition is dialed in, but recovery is lagging, and they can't seem to break through. We know growth hormone drives protein synthesis and tissue repair, and production starts declining earlier than most people realize. While we don't have large trials on Sermorelin specifically in young athletes, the mechanism is sound, and what we see clinically is that a short-term course can sometimes be the missing piece to optimize recovery and help them push past that wall.
And the second group, and this is one that we're seeing more and more, is patients on GLP-1 medications like semaglutide or tirzepatide who are losing weight but are also losing muscle mass along with the fat. Clinical trial data shows that up to 40% of the weight loss on these medications can come from lean mass rather than fat, which is a real concern because your muscle is metabolically active tissue. You don't want to come out of the other side of a weight loss journey weaker and with slower metabolism. Sermorelin supports the growth hormone axis that drives muscle protein synthesis, so it can help preserve and even build lean muscle mass, while GLP-1 is doing its job on the fat loss side of things.
And that's an important point, Becca. We're seeing patients who have lost 30 pounds on a GLP-1 and look great on the scale, but their body composition scans show they've lost a significant amount of muscle too. Adding Sermorelin, combined with resistance training and adequate protein, can shift the ratio back in a much healthier direction.
And it makes sense physiologically, right? The GLP-1 is working on appetite and insulin signaling, and Sermorelin is supporting the growth hormone axis that drives muscle protein synthesis and recovery. They're addressing two different pathways, but together they can help patients lose fat while holding on to the muscle they need for their long-term metabolic health.
All right, let's wrap up with practical takeaways. Number one, if you're experiencing stubborn weight gain around the midsection, loss of muscle tone despite training, poor sleep, slow recovery, declining vitality, or you're on a GLP-1 and concerned about muscle loss, have a conversation with your provider who understands peptide therapy and the growth hormone axis. These are signs that your hormonal environment may have shifted, and Sermorelin could be worth exploring.
Number two, if you're considering Sermorelin, do it through a clinical practice that specializes in hormone and performance medicine. You need individualized dosing, pharmaceutical-grade sourcing, and ongoing monitoring. Not just a website or not just a buddy at your gym.
And number three, peptide therapy amplifies a healthy foundation. It doesn't replace one. Dial in nutrition, prioritize resistance training, optimize sleep, manage stress, and address other hormone imbalances. Sermorelin is a powerful tool, but it's one tool in a comprehensive performance medicine approach.
Yeah, well said. And for anyone who wants to know if peptide therapy might be right for them, we do comprehensive evaluations at our clinic, which include labs, body composition, and a deep dive into your health history and your goals.
Becca, this has been a fantastic conversation. And to recap, Sermorelin is a synthetic version of your body's own growth hormone releasing signal. It works with your own physiology rather than bypassing it, has strong safety profile backed by decades of use, and when paired with a comprehensive performance medicine plan, it can meaningfully improve sleep, body composition, recovery, and vitality. If that sounds like something you'd benefit from, reach out through our Vitality Evaluation, a comprehensive consult plus same-day labs that work to see what exactly you need and where you stand.
Thanks for joining us today, everybody. If you found value in today's episode or you learned something new, please leave us a review, subscribe, or share this podcast with a friend. Your support helps us to provide free content to support you on your journey to better health.
And I'm Dr. Jamie Lewis, reminding you your body holds an incredible potential to heal, thrive, and perform. Sometimes it just needs the right tools to unlock its full potential and help you live your best life now. We'll see you next time.
See you next time.